Hello all. We all are facing unprecedented event of a pandemic of an infectious disease. No one has experience about it. So many countries in the world are struggling to control the disease. Now when we are going to be the front soldiers against this war with corona, let's try to see how we can stay safe from novel corona. We will see preventive measures for the same. In the outset, I would like to tell that when I saw the CDC website, CDC says PPE is the least effective control because it involves a high level of worker involvement and is highly dependent on proper fit and correct consistent use. And there is a shortage of PPE in many countries. So if in our country, in our hospital, we will feel that PPE is not as per your wish, do not get tense, because there are many other ways which will keep you safe, and as per CDC, other measures are more or at least equally important with PPE. So the most important thing that we can do is source control. Means what? We will limit the spread of the virus, and the virus in our hospitals, in our wards, will be present. The source will be the patients, isn't it? So we will try to contain the virus so that it will not contaminate our wards and other surroundings. So for that, the most important thing that we should ensure is an infected person needs to use a mask continuously and properly. But we all know that wearing surgical mask continuously is a very hard task. So it can be ensured only by counseling to them about its importance. Now, while telling the reason, if we will tell them that it is being done for making us safe, their compliance probably may not be perfect. So if we involve them in this work by saying that by using mask they will not get repeated infections, then probably they will have a good compliance. So try to use a language which is very kind and try to counsel them, try to tell them the importance in various ways. Similarly, we have to ensure hand washing by the patients in the ward too. The safety measures apply to everyone, isn't it? So along with the prudent use of available PPE, the guidelines are already with us. They will be discussed in other lectures. So with the prudent use of available PPE, the other things we can do is limit patient movement in wards. Ask them to be in their place or demarcate the areas where they can go. Minimize the patient contact time. Whenever you want to do some work with the patient, if possible, you can club the work together and try to limit the visits in the patient area. Limit touching various surfaces. If we notice, usually we touch unknowingly while going, we will touch the cot or we will touch some paper. So try to limit touching various surfaces. Be conscious of that. Ensure regular cleaning and disinfection procedures for high contact surfaces. If it is dirty, clean it prior with soap and water, and then disinfection has to be done, and this has to be done it should be followed as per the guidelines for high contact areas. Laundry disinfection is very important and should be done as per the guidelines, and especially the terminal disinfection after the patient is discharged, that process is to be meticulously followed. Most important procedures are aerosol generating procedures. Now these procedures are where the patient can cough. For example, sputum induction or open suctioning of airways, intubation, extubation, manual or non-invasive ventilation. Such kind of procedures are very risky because they create aerosols and they should be performed very cautiously. Use of appropriate PPE is a must. Then we can limit the personnel who are present while doing the procedure. It can be done in a designated place or room or with some protection available, and we can immediately disinfect the surrounding surfaces and area after the procedure is done, so that the further spread of contamination might be controlled, and the cleaning has to be done in wide area. Apart from PPE and all disinfection and everything, please remember virus will reach your mucous membrane specifically with your hands. So hand hygiene with or without PPE is must, and it is most effective. So a healthcare worker can perform hand hygiene before and after all patient contacts with potential infectious material, before putting on and after removing PPE, including gloves. Now I have underlined the word removing PPE, and this is the most important procedure because that is the time, if it is not done correctly, there are chances that your hands may get contaminated. So try to remember the procedure, the chronology, and try to follow it as properly as possible, and after that meticulously wash your hands at least for 20 seconds. Alcohol based hand rubs are also good. It has to contain 60 to 95% of alcohol, and for using hand rubs also you have to follow all the steps of hand washing. And when hands are visibly soiled, wash it before with soap and water and then use alcohol based hand rubs. There are some simple important measures also, like do not use any mobile while on ward duty, or at least minimize the use. You have to disinfect mobile very frequently. Stop using mobile covers. Don't wear jewelry at work because we can't disinfect it properly. Disinfect spectacles regularly. If possible, avoid using lenses. Keep minimal belongings with you, just the minimum needed things, some coins, some notes or card, or just keys and license, minimum things, and segregate them at home. Work clothes can be washed separately. You should take bath if possible before or on entering the home, before touching anything. Get the nails properly trimmed and reconsider facial hair. This is for males. So why this is important? This is the guideline given out by CDC. Here you can see various styles of facial hair and which ones are okay to use with PPE and the ones which are not allowed to be used in PPE. This decreases the safety or it increases the chances of infection. So this is an important guideline. Go through it. And please remember, we have to be alert to stay safe. So let's be vigilant. Most important thing will be to have nutritious food and adequate rest. This is most important. Then at home you can minimize close contact with family members, especially the elderly family members. Keep safe distance from them. Disinfect frequently touched surfaces at home too. Keep washing hands and using hand rubs at home too, and this is for everyone at home. And practice self-monitoring for temperature and respiratory symptoms. Every day at least twice you can monitor yourself for temperature and any respiratory symptoms. Whenever you are in doubt or if you want some additional safety, one can use mask at home too. So with these many precautions, I think we will be safe and we shall fight this corona and we will surely win. Thank you.